Hello, good morning. Good morning all. As we scheduled it, today I'm going to give you a presentation and later maybe you can make questions through Twitter about the topic or out loud or in the chat at any time. Okay, because we are not too much people today. So I think there is chance that anyone can make questions. But first of all, thanks to Celfosc, la Asociación contra la Contaminación Lumínica, that is the main light pollution activist organization in Spain, for letting us organize this event and use the our Zoom account. Also to thank who is paying me, that is the Universidad Complutense, through a European grant called Una for Career under the Una Europa organization that is paid by the European Commission. And then also to the Exeter University and the Instituto de Física Andalucía. There are another two organizations that I'm affiliated to, and also to the International Dark Sky Association, that is who organized the International Dark Sky Week. Today I'm going to talk a bit about a topic that is what you have requested, no? That is the measurements in light pollution for in human health. That is a hot topic. So obviously, I'm not a doctor, so everything that I say about health is going to be from the outreach perspective. But I'm collaborating, as I will mention later, in several projects to measure the light for human health topics, and that is my field of research. So on that, I can talk quite confidently. Now, one of the things that I start to talk about nearly in every topic, so every talk that I give, is this picture, no? Because everybody knows this picture. No, is one of the most iconic images that we have worldwide. Although there's a small, big problem with it, that is fake. It's a fake image. It's not truly fake, but it's fake. In a sense, is the true picture is this one. No, it's a black and white picture. Yeah. So what is fake is the color, this yellowish color that we see, because that color is an artistic interpretation, no? At that time, when the image was produced in 2012, based on another image of 2010, no, of 2001, the most of the illumination in the world was sodium lamps that are yellowish, and they are quite different from the lamps that we have at home, even in our houses. But is the most typical lamps on the streets. Maybe I would talk. Probably I would talk a bit more on that detail a bit later. But we are trying to have a real picture in color of the Earth, and this is a glimpse of what we are trying to do. This currently is a bit of a mosaic of images. So it's not one single picture, but we are working quite hard to try to have something, a real picture of the Earth at night in color. And why we care about light pollution? Well, but there is many topics. Today we are going to talk mainly about health, but there is many topics from breast cancer and prostate cancer research, ecosystem disruption, disruption of pollinators, as included in the ecosystem, plant disruption, bats, seabirds, turtles, child growth, sustainable development, astronomy, migrating birds. Is many topics. But today we are going to talk about health. These are the topics that we are currently helping in the Cities at Night project. That is part of the is like the umbrella, the citizen science umbrella that is helping us to coordinate the efforts to calibrate these ISS images, no, the images that are in color. That the astronauts takes, that probably currently the best that we have for as public data to trace all these aspects. Because this is the challenge, and this is the challenge that we have for human health issues. No, many times the problem that we have is that we have a remote sensing image like this. This is a picture of Granada. And from this, we want to derive the light that goes through the window and impacts our baby's sleep or our sleep. And so it's quite a challenge. It's quite a challenge. Something that what is the intensity is a big challenge. For example, if we have blinds or we have shutters, or even the orientation or the 3D structure of the city is quite difficult to predict. But the color of the light that will come through the window and the statistical intensity might be not so difficult. We have to think that before most of the studies, the light pollution studies, were done with this. Well, even worse than this. This is the resolution of the BEARS that has 750 meters per pixel, or the original pixels, because then is resampled at 200 and around 400, 500 meters per pixel. This is the resolution that we can have with the ISS, that is around 4 or 5 meters in the best cases. But now we are going also to some commercial satellites that allows us to even go further and see individual streetlights. But this is commercial data. So we only have available this kind of data for very few locations. Not as few as the ISS images are also only available for very few places, but still more than when we have this. This is an image taken by the Gimlin constellation. So this is what what is public and quite well calibrated and available nearly everywhere. This is what we are using in some of our studies. This is what we are starting to use. You can see that there is some challenges, for example, in detection, but the resolution is way better. Now here we can see individual streetlights, where here we can see individual streets, but not yet the streetlights themselves. Some hotspots, but not the streetlights themselves. Here now we can see streetlights, individual streetlights. And here, not only we can see the streetlights, but also the street structure. So I'm going to zoom into this pixel of here. So this will be 1 pixel of of the beers. And this is what we see. So you can see from not seeing absolutely anything to seeing in the ISS, so the street and some of the hotspots. Now with this, we see that some of these hotspots are actually not one hotspot, but several, like 2. And then this is with the GeneLink. This is the ISS. And then if we take a plane picture, then we can see the street structure and not only one, but many lights. One of the issues that we see when we see at this scale is how difficult it is to measure this light pollution, because the 3D structure, just the buildings, blocks a lot of the light. No, and first of all, this light that we can see here, we don't see it that well here because of the angle that the image is taken. No, so that's one of the first challenges. No, is that the streets are quite complex in 3D. The other thing is that the same happens with other pollutants, like, for example, the air pollution, no, or the radioactivity. So, or even the noise pollution. For example, right now, I hope you cannot hear it. I have a construction not far, but because I have the window and this has probably some noise reduction, you don't hear that noise. But if I was taking measurements outside in a noise map, probably I will have this noise, although the real noise that I have in my house now is quite different, and later at night this construction will not be happening, so the noise will be reduced. And even if I go inside my house in different rooms, I will not hear this. So the problem, and this is another of the issues that we have, is that it's true that in general the complexity of the pollution is complex, but as I'm going to put myself 1 second the chat, because I don't know if someone is saying something. 1 second, I have to stop the okay, no, all right, I continue. Okay, so this complexity is not only happening in light pollution, it's happening in nearly any other pollutant, environmental pollutant that we might consider. But why we are caring about the intensity of the light and how this is so relevant? For example, in 2016, the American Medical Association made a statement about how harmful might be the LEDs on the streets for our health, for several reasons. No, for glare, for potential damaging our eyes, that is heavily discussed, and in general I don't think is really a problem. The main problem is the disturbance of the sleep. No, and the disturbance of sleep is linked to many issues like obesity, diabetes, and another topic that is discussed is the potential link with cancer. That I'm going to talk about it today because it's one of the things that I work with. although it's quite controversial, no? But I have to talk about it because it's what I collaborate with the most. But it's not the only issue, no? For example, another of the topics is the increase of risk of diseases carried by vectors, no, by viruses. For example, here is 3 articles about how the malaria and the Chagas was increased in some places after the street lights were introduced. No, we are talking about places that they didn't have any street lights, and when they get the first street lights, these vectors, these mosquitoes or these parasites are more active because these mosquitoes are not the kind of mosquitoes that are mostly active during the night. These mosquitoes are typically active during the day, but they're active during the day because they need light to operate. And when there is light, they can operate also at night. So this makes that they have double chance of being active. So, for example, the West Nile virus, there's several articles about link with light pollution, and also these ones of malaria and Chagas. No, so even sometimes it's not the light itself what is hurting us, is other diseases carried by mosquitoes. And for example, in Spain, where I live, we have a problem because we have the mosquito tigre that happens the same. Is able to carry some of these virus, these diseases, not in Spain yet, or not many cases, but it's just a matter of time. But the main reason why the light pollution is an issue for our health is that our health is driven by hormones, no, and these hormones are linked to a clock and several clocks in our body, and are synchronized by hormones, and that feels when we eat, when we sleep, when we are more active, when we have more exercise, and this is a loop, no? And if we with our activities or with external lights, we change our hormonal system, this influence some of the hormones, mainly the most popular, but not only, is the melatonin, and we change this, and that's what makes this social, not only the social jet lag, no, because many of us have real jet lag, but also is enhancing the social jet lag. These are some of the hormones that are influenced by the day-night cycle, and the melatonin, you can see, is the most dramatic one, but it's not the only one. No, for example, the growth, the cortisol, the insulin, the glucagon, and many hormones, the adrenaline, and so it's a problem, because this means that not only our sleep is disturbed, no, many other topics might be disturbed because of our poor sleep, and this is absolutely proven, and that the light affects the segregation of melatonin is also absolutely proven. What is the conflict right now is how much light and for how long, and many other these topics, no? Here we have another graph of, for example, the cortisol, how it goes during the day, how it goes down during the night, when we go to sleep, and then goes up the melatonin when we have to start going to sleep, and goes down when we have to wake up, and the cortisol rise up to wake up us. Something that is known, for example, is that people that have some diseases are more difficult to recover their circadian rhythms. No, for example, here is a time where these two groups have a regular sleep, then they're exposed to light for several days, and you can see both groups are disturbed, no, after several days of sleeping with some light. The problem is that the blue one gets synchronized in few days, but the red one takes way longer to get synchronized. And for example, this has impacts in mental health issues. There was a big discussion about the LEDs, and there was this was in Europe. We think probably by request of the industry, because there was a lot of discussion in Europe after in 2016 about this statement from the medical association, the American Medical Association. So the Scientific Committee on Health, Environment, and Emerging Risks, the chair made a statement. Oh, sorry. But there was some issues. Is that even if the statement was published the 6th of June of 2018 about the potential health of the LEDs on all the science that was fed into this committee ended the 17th of September of the previous year. And several of the articles, key articles on this topic, were published just after. Probably would not have been enough to change the opinion of this committee. And I really suggest you to have a look on the statements of this committee, because, for example, not only the statement itself, but also the feedback that was given from the public and the experts that gave to the committee. No, for example, something that is interesting is that nearly most of the comments to the committee were made by the industry, but these were not disclosed. Okay, so nearly only the comments from the scientific community are public, and the answers are also public and are quite curious in terms of, for example, many of the comments are, well, we don't have actual evidence yet enough to prove, for example, light produce cancer. And absolutely now still we don't have that evidence, but there is a mechanistic model that explains why this could be happening. And therefore there is a risk, and therefore we should apply the precaution principle until we don't have evidence. Well, we don't install things that are mildly and probably harmful. But even if this is the Scientific Committee on Health, Environmental, and Emerging Risks, the committee said that they were not who has to take the action to evaluate these risks. So my question is, if this committee is who's supposed to be evaluating these risks, and they are not, who is who has to apply the precaution principle? That's my question. But then, as I said here, many of these things were not considered, and say here, no, for example, that there is some evidence of late evening, but still not enough clear. No? Except, for example, some potential in flickering and other topics, no? And it's something that is really and they say that the LEDs is evolving fast, and they consider it's important to monitor this risk in the long term. So they actually acknowledge that it's important to control this risk. For example, one comment from the UK was talking about how the LEDs are often the most they are quite efficient than other sources, not the sodium lamps. At that year, no, in 2017, the sodium lamps were still more efficient than most of the LEDs. Yeah, and this was a statement there, no, made by this person. And as I said, most of the comments were made by the industry, but they were not public. This is a document from an article from the ILP, where they were also talking about this human health, and there's this statement saying that there is no evidence of any photovoltaic benefits. That contradicts what they said before, and also the other problem is that this was published in July on 2018. And the dates are important on this topic. No, for example, this other guidance of the ILP is from July 2017. But what happened? That, for example, our study on breast cancer was published after, no, and first of all, what is known is that there's already a link established between bright light and risk of breast cancer on shift workers, mainly people that have like the most bigger light pollution issue, that is just sleeping during the day. No, but our study, for example, was to trying to show some link between dim light and risk of breast cancer. No, that is a challenge. It's a challenge. Another topic that is also very important and is also considered in the statement of the American Medical Association is the glare. In terms of, is known for very long time that glare is an issue, first of all, mainly for drivers. And here even you can see what is the difference of discomfort between having a light coming directly close to the fovea, only 5 degrees apart of the fovea. Fovea is the center of our field of view, and we see that we are more sensitive in the blue light, in the more orange, but the more that we go off is we are much more sensitive, no? And this is because of the rods that we have, no? That is our nighttime vision, that we are much more sensitive to this. And this is, for example, in particular, in my case, I get really annoyed with in some tunnels when they have LEDs, because they light a continuous line, and when they are shining in the edge directly to my eyes is really disturbing me. There is already articles even way earlier in 2005. First of all, I think the glare was not even considered in general in this article for in saying this work from the European Commission. And we can see, no, this is tungsten. This is for headlights of cars, and we can see how this is for the same illumination. Yeah, is clearly always more glary the more high color temperature lights, and the tungsten that the traditional lights in cars are the least glaring. So that's why this is a big issue, and we should stop putting this blue light in the headlights of the cars, because it's already known for quite long. So this should be forbidden, in my opinion, because we already know that it's really a problem, and with the age of the people, this problem is even larger. But how we can measure the light pollution? Well, there was a commission on this topic on the CIE, and what they agreed is that we should use the spectral responses of the human photoreceptors to trace all environmental, all impacts on health. No? So the industry is asking us that any light source that we and any study that we make should be using these curves. But obviously that's a challenge, because these curves are not standard filters. We don't have detectors except the humans to measure this. So that makes that, yes, it's better have this than just asking for the spectra of the light source, but this makes the things more difficult for us. Although we published an article, and here is, for example, in the audience is my colleague Carlos Tapia, that collaborated with me in this article, that we've proven that we don't really need these 5 photoreceptors, because we don't have random light sources. Now we have light sources with very specific spectral responses, and with RGB, with the colors that we have from our DSLR, we can get a quite accurate estimation of what these 5 photoreceptors will be. No, just by doing a linear fit in RGB, in 3D, we can have a quite good estimation on that. Then we'll have issues on what is exactly the intensity, no, and this here there is a challenge. For example, what we should have a camera on our eye. That probably is the best. Some people use watches, no, to check the amount of light. Obviously, you can if you don't wear glasses, it's quite challenging to have something on your eye permanently. But if you have a watch, well, you can carry that watch all day, no, and that's not so critical. But for us that we do the field measurements, well, for that the good news is that we don't need a super hyperspectral camera that with 5 filters or even more filters to do the science. We can do it just with RGB sensors, no, with DSLRs or mirrorless cameras, with compact cameras, even with mobile phones. The challenge will be that we need to calibrate them. But if we only want to do, for example, have a color estimation, very broad color estimation, but we can do that with mobile phones. We are preparing a paper to show that. And what about these other sensors? No, the SQM and the test. But they might be useful for outdoor or even indoor, although they measure sky brightness. So the units are not prepared, but probably we can convert these units. But if you see, this is not the regular SQM. Here, this is an add-on. There's a filter. And so it's very important that we introduce filters. So we have this RGB, or at least 2 colors, no? At least 2 colors to estimate the amount of blue light and green light, because both are quite linked. Currently, about the cancer, that is probably the most topic and more controversial, and that's why I'm going to focus a little bit on this. There's currently 3 papers that seems to have results showing that might be true, that there is might be an increase on risk from the statistical point of view. Even we cannot really say that is directly linked with the lights, because the lights can be just an indicator for all things. But there is another paper where I collaborated with. I'm not in the authors, but I'm in the acknowledgements, as you can see here, where they don't find this correlation. So now it's still a controversial topic and a topic on research. So we cannot say that we know that there is epidemiological evidences of breast and prostate cancer and colon cancer also, that we have another paper about that topic, with lights and satellite data. But we can say is that it's something that we have a good reason to think about it, and why we want to study this. But we still have only 3 studies, 4 studies that have color information, and there is some link with these slides. Here is our first article about this, and listed the second. The first author was Ariadna Garcia Saez, and sadly she's no longer doing research, but her supervisor Manolis still, and we're still working on this topic. What was the methodology of this article? Well, the methodology was check the outdoor lighting of Madrid and Barcelona, so not everywhere, very particular places in Spain. And Spain is one of the countries with more intensity of the light in the streets, and also places that have a population density very high. So for example, that this is an important factor, for example, compared with Canada, where the population density is much lower, and therefore there's more trees. The streets, the houses are farther away from the street lights than in a city like Madrid or Barcelona. And also they were, and this is quite crucial, they need to take care about other factors like noise, age, diet, air pollution, and many environmental variables. This is the two images that we used. We chose these two images because they were late at night images. And therefore, here we don't see the hotspots of the center of Madrid, no, for example. And here, for example, we see this color on Ciudad Bella in the medieval part of Barcelona. But and we can see that both cities are quite uniform on their intensity on the streets. But even though we know that the 3D structure of the city is not that uniform. These were the results, some of the results, and we didn't find any significant correlation with intensity. But we did, but we see, for example, this was the intensity that we were seeing in the satellite here visually, and this was the light that they had in the room. And something that we found is that this was a bimodal distribution. We have two peaks. We have a peak here in a lot of light, in bastante iluminada, with higher visual light, but also completely obscure, completely black, the room. No, and this is something that obviously my colleagues that are epidemiologists know much better than me, and they explained to me, and this was part of my task, be skeptic and ask these questions, and why this is not happening. No, why we don't see a problem with intensity, no? Because the most intensity should mean the most disturbance. But they told me, oh no, because the more exposure to contaminants don't really mean that you are actually exposed to those contaminants, because when there is more contaminants, many times, for example, in a nuclear plant, you take care more, so you prevent this. And this is probably what is happening here, no? That people that live in quite bright areas, they know and they are disturbed, and so therefore they put blinds and they put shutters, so they prevent to get light. Oh, this is really a trouble for us, no? And probably the people that is most exposed is people that are in illuminated areas, but they are not really aware, and maybe people that is in between, no? So if you see, actually is what we see. People that are in a bit darker areas have more light, no, than people that are in very bright areas. But also people that live in bright areas has more light, but you see the distribution is quite broad. But the color, no, because changing the color of the light is much more difficult. And we saw these correlations, no, in breast cancer and prostate cancer, not with the visual light. Yeah, with the visual light we don't see a correlation, or this make this blend, but we see it with the color. This MSI is an estimation, is like a kind of blue filter, no? The amount of blue light really saw a correlation. So our recommendations is, well, or maybe we should reconsider the hype of the white LEDs because it's established a link between the sleep quality of the citizens globally. Even the LEDs with zero upper light ratio can emit in people's houses, yeah, because and be careful, very careful with the diffusers and the retrofits, and mainly will be our recommendation is to use blinds and use shutters to avoid light exposure during the sleep, no? Because it's known we used to sleep in caves, yeah, with no light 2 million years ago, no? And so we can really do that. The problem is, first of all, in some countries, like in Spain, if you want to close your windows in summer, there's a problem because maybe you will be forced to use air conditioning at night, and they will impact the energy savings. So it's tricky. But the other thing is that we should expose ourselves to daylight, yeah, light during the day, because that's also helping us to control our circadian segregation. And then the other problem is, okay, Alex, I trust you. Yeah, maybe the light might have a problem, no? But the problem is the dose. How much light it will impact my health, no? And this is one of the problems, no? One thing is that there is a link between the contaminant, and then is the dose exposure relationship. And this is where is the research. No, we don't know this case in the case of cancer, but we have to think that most of the dose exposure studies right now have been for exposure for short term and not a chronic exposure. For example, anyone could say, oh, the sunlight don't produce any harm, no? But when we see, for example, this case is published is a truck driver that have the left window was exposure to light, not UV light, and not the left, the right side while he was driving, and you can really see the difference on the aging of his face. So right now we have to say that we still don't have enough data for something, first of all, to knowing how this impact in cancer, no, on our, but the chronic exposure to lack of sleep, no, that is what probably is an issue. And also with, for example, in many topics like our eyes and so on. But we have to be careful, very, very careful on what we say. Yeah. One thing is that there is a potential link and a proven link in a short term, yeah, and then a completely different topic is in a chronic exposure. No? So this is a topic that we are on research, yeah, but we should apply the precaution principle, and when we don't know, we don't take the risk. If we can avoid it, and there is no reasons to do so, because we know that even if in humans there is not yet a link between a well enough established link between health and light exposure, in the ecosystems there is, and any given level of illumination, there is ecological impacts. And the precaution principle say that not only we should apply it and limit our activities when there is an impact on humans, but also in the environment. So even if the research on humans, or even in the labs about cancer, about diabetes, about all these topics, still in research, yeah, we should apply this for mainly for ecological reasons, but also because we still doing the research on how this is happening between people, and these people that is much more sensitive than others, no? And here, for example, is a quite recent article about the exposure and how melatonin suppression was between different colors, and you can see even in for quite low illuminations, like we're talking about 1 lux, melanopic luxes, we really can see effects. Be careful, because this is a logarithmic scale. So 1 lux is here in 0, and is when we start to see the effects. But there is a dispersion here, okay? And even for some measurements, that's supposed to be an effect even with quite dim light. But this is maybe errors on the measurements. Well, we see the dispersion here is very big. But we can see is that when we use green light, no, or red light, we can go 10 times brighter. So we can illuminate as we used to do it with orange lights and have more light on the streets without the health impact. But the other issue is that there is a lot of dispersion between different people. So this was differences in color. This is in people, different people. And you can see these curves are completely different from some people to other people for the same light. No? And we should not care only about one kind of population. No, we should care about all of us. And if you see, these measurements are always up to 10 lux. No, and we should explore also this dim light. No, this part of here from 10 to 0. Yeah, because we see there is people that is still quite sensitive at this level, very sensitive. If there's people, no, there's people that they can have even 100 lux and their melatonin suppression is even not, they are not feeling it. But there's people that at 10 lux they have way higher. And but there is challenges also in detecting the melatonin in low doses. So there is also technological issues here on that level. Well, this is what the people, the industry is right now pushing. That is, first we are going to convert everything to LEDs, and you can see that they wanted that this is fully accomplished for 2025. Then they're starting to have intelligent systems. The question is why we are installing LEDs if they are not intelligent, because they are the most important. And then that we do lights focus on humans, no, and that this will be more sustainable. And the funny thing is that this is, say, more sustainability, but is here not being considered the environment. And that is what we should do. What we should do is not only consider the knowledge in the academia, not only the industry, not only the governments, also the society and the environment. This is the fifth helix paradigm, that is what we should care, no? And for that we need measurements, and they are not so difficult to take. Yeah, at least in the light part with DSLR cameras, we can do it. And there is several documents already at the European Commission that say how, first of all, we should not use street lights for more than 3000 Kelvin. And even in the lower, the best. Also, the International Astronomical Union saw how we should use only street lights when they are needed, amber lights, reduce the power, put street trees and things to block the lights, and direct only the light to the ground, and mainly on the field, because in the cities the buildings block a lot of the light. And this is a bit what is said in the 5 lighting principles: is minimize the amount of light, study the place, consider only the light that is really needed, and use timers and dimmers, and put the light down, and the less blue, the best. And this is a bit what I have for you. If you want to make some comments, I have other slides, back slides, in case we still have like half an hour, in case that you want to do some questions. And so if you want to activate your cameras and make some questions. If you want to do it in Spanish, because most people here is speaking as Spanish speakers, I will translate it for the record. And you can also type the questions in the chat if you want. Any questions? Well, if you don't have questions, I have other slides that might be interesting for other people. For example, one topic that is quite many people ask is, oh, but the LEDs are environmental friendly, no? Is what we should do. And yes and no. So in interiors, it's true. Yeah, they are. The LEDs are environmentally friendly, but in outdoor is not so clear. And the reason is because the production of sodium lamps, these orange lights, are very sustainable and quite efficient. The white light is known to be very harmful for our environment and also for our health. The most efficient light source on the planet is still the low pressure sodium lamps, but they have been stopped and being produced, at least in Europe. The efficiency of the LEDs right now is higher on the LEDs, but many times it's not, the cost of the change is not profitable compared with the sodium lamps. Although the efficiency of the LEDs is increasing very fast. So, and that's why right now it's true that for some LEDs, not for all, for some LEDs, there is a higher energy efficiency, but we should limit this blue exposure. And one of the problems also is in the manufacturing. When we see this article, we see, for example, for climate change, no, the manufacturing of LEDs is way more pollutant than the manufacture of sodium lamps. So only when the energy efficiency and the light used is good enough, we can balance these two things. For example, this article in this manufacturing bit, I think is quite reliable. Not so much on this area because, for example, they were claiming that the LEDs were going to be last 100,000 hours. That goes against the standards right now, because the standards say that you cannot say that a street light is going to last more than 6 times the tests that have been done, and nobody makes tests for more than 50,000 hours, no, because it will be too cost and it will take very long to take a product to the market. No? This is assumed on this bit that I was mentioning. And the other problem is that there is a debate. No, most of the people say that LEDs produce more light pollution, and other people think that LEDs produce less light pollution. And this is because the LEDs can direct the light more efficiently to the ground, but we have the problem of the color. No? And but this is even acknowledged for many lighting professionals. And I hope this has been interesting for you. There's many other topics that I had here. For example, we should take care about the illumination that we have indoor and what we are exposed at night. And we should also think, no, what we like, no, a wall that is like this, cozy and romantic and warm, or we want surgery places. No? And you can see what is the kind of lighting that you have. Even it's quite unhealthy. No, it's one of the paradox that these medical centers have such a blue light when they are taking care of people that is not healthy. And this is something that is changing, and in several places they are trying to improve this by having a much better lighting and dynamic lighting in these spaces. And there is a lot of references on all these topics. And I will make available in Zenodo this presentation. So I will put it in the description of the video. And I hope I was not presenting, I was not sharing my screen. Sorry, but now I'm sharing. Here is some of the references. Okay. And this is the colors that I was mentioning of what we want. One color lighting and more romantic and more sustainable and more healthy, or we want lights for surgery. And this is the bits that we're showing you about the manufacturing. No, what is the impact on manufacturing LEDs and sodium lamps. And thanks to all of you. I hope you enjoyed the talk. And this is your last chance to make any questions in the either in the chat or later. Oh, here, how much effect of the flicker on the circadian rhythms? The flicker. Well, this is the bad thing. I'm an astrophysicist. I'm not. So the only thing that I can talk about the bit of the health is on the from the outreach point of view, no. And from that I know the flicker, it don't impact our circadian rhythm, but might impact our health. for example, the flicker is quite known to have an impact on people that are sensitive to flicker. Although one of the issues here is also many times the lights that we have been used to have high flickering, like the fluorescents, also emit a lot of UV light. So it's clear that the flicker is a problem for people that have, for example, epilepsy. But for other people that don't have epilepsy, maybe it's the exposure to blue light that traditionally we were assigning to fluorescent light. And for example, with the LEDs, there is LEDs that they have absolutely zero flicker. And there is other LEDs that have a lot of flicker. So it's a problematic topic, no? And there is plenty of research on how the flicker is an issue for not for most of the population, but for some people. For example, people have mental issues and also this topic, no? Epilepsy. No? But my concern on this topic is how much of the issue is on the blue light or even UV light than the actual flicker, no? And that's one of the things that I hope in the next years will be more study, no? I have to say, this is not my main field. First of all, I have not talked so in depth on many of these topics, no? But for example, the same that I can say, our mobile phones can measure flicker many times, not the DSLRs, but the mobile phones does. So it's not so difficult. We have to be more used to measure these things. No, your mobile phone, most of them have the chance of putting video on slow motion, and you can measure this flicker and check if your street light, if your lights at home or in a mall have flicker or don't have it. So you have the chance there to test, no? And many of these things, obviously we are scientists and we want to know for sure in an accurate way, and many times following your intuition, yeah, with common sense can be a good guideline, no? Because at the end, if you don't feel nice, it's because maybe that light is not being nice to you. Thank you very much, Anibar. I'm Van for your question. If there is no other questions, we still have the session for another 17 minutes. If there is no more questions, I'm going to stop this call, this recording, and post it online. I will post it in my YouTube channel, and I will share it with all the people that was registered for the meeting. And I see you later at 5 in Europe for the remote sensing conversation. I hope you enjoy it, and I'm going to stop the recording now. If you want to chat for a few next minutes, I will still here, but this will not be recorded.